This morning, we have more uplifting scenes like this. Frontline workers in Texas, New Jersey, and Florida getting the vaccine. It's very exciting, but at the same time, cases are still surging, and our country is failing at testing and contact tracing. But there is one community that isn't. In Davis, California, health officials have established the Healthy Davis Together Project, an effort to test all residents, trace positive cases, and get the virus under control. The doctor spearheading that effort, Associate Dean for Public Health at UC Davis Health, Dr. Brad Pollack. He joins us now. Dr. Pollack, this started as a testing program for UC Davis students, and then you expanded it to the whole city. How does it work?
Well, we actually planned it together, believe it or not. If you go back to last summer, one of the major fears was that across the country, that college students would be returning to their communities and infecting the townspeople. So we actually had started planning for this Healthy Davis Together project back in July and went live in mid-September when students were moving in. But the idea was not only to test and do all the appropriate things on the campus itself, but actually to involve the community directly. And that led to creation of the project, which is a partnership between the City of Davis and the University of California, Davis. So it's been very gratifying to see that. And we just went live with community-wide testing about 3 weeks ago. We did start testing our students on move-in September 15th. And so the campus was pretty much locked down. We've had very low rates on the campus itself. The community is relatively low relative to other communities, but again, higher than the campus itself. But as I said, 3 weeks ago, we started doing community-wide testing.
Most of us around the country, when we think we're exposed, we spend hours looking for a testing site. Then we spend hours waiting in line to get tested. And then we spend days and days waiting for those results. What's the timeline where you are?
Well, that's great. You're absolutely right. The testing availability, of course, part of that was an artifact of the technology. The technology's evolved over the course of the pandemic. At our place now, we went to using a saliva-based PCR platform. So the saliva is a lot easier to collect than doing the nasopharyngeal swabs. Obviously, it's not invasive. And we started that, as I said, mid-September on the campus itself. Right now, we have people that can get in and out and get tested, and the entire process takes less than 5 minutes. And the results are returned within 48 hours, and actually the vast majority of the results come back within 24 hours. I'll just point out that Yolo County, where the City of Davis is located, when we were looking at this in summertime, they were getting results coming back from some of the commercial labs up to 8 days late. So their efforts to try to do contact tracing on a case that may be 8 days old were really futile. They didn't have the person power to actually do that. So they just skipped those cases. Now we have a much faster turnaround time, and it's open to everybody in the city, all the residents, and also to people that work in Davis, but not necessarily living there.
I want to share, in addition to you and I speaking right now for our audience, on the left side of your screen, Howard University, where we are seeing vaccines take place right now. Talk to us about how you made these tests significantly cheaper as well. For most of us who want to get those at-home saliva tests, they cost $100, $150.
Yeah, well, we happen to be a big ag school, big ag research school. So, of course, we turned to ag biotech. And we ended up using a platform that was designed really for looking at plant pathogens, looking at DNA, RNA for plant pathogens. It uses a ribbon tape type of process where you have little micro wells for these little PCR reactions. So it's a much higher throughput platform than you'd have with a conventional, some of the other commercial machines. So that was one thing that we did. We worked with a couple of the vendors to actually perfect that. And then we ran the first 3 weeks or so of our testing. We actually ran that in parallel with nasopharyngeal testing from a commercial lab to make sure that we had results that were concordant. So the fact is we're able to do a lot higher capacity testing with this platform at much lower costs. The unit cost may be in the order of about $6 per unit. Now, that's not including acquisition costs of getting the specimens and so on, but that's an order of magnitude lower than the commercial PCR tests.
Less than $10 a unit. People can get in and out to get the test, and they get the results within 48 hours. Could this have been done on a national scale?
Hard to say. I mean, we were pioneering a lot of this. There were other universities that tested saliva platforms. It's a learning curve, as it has been throughout the entire pandemic. So scaling this up is important. Part of the goal of the project is to not only sort of try to take care of our community here, but it's to help write the rule book for other communities, to try to generalize our findings to other communities. So this is one aspect of it. I want to point out also, though, that the Healthy Davis Together is not just the conventional epidemiologic approaches, which is testing, contact tracing, and then fast quarantine and isolation. It also involves behavior change. And so one of the major things that we've been doing now is to deploy all the tools at our disposal to do mass communications. We've employed about 300 undergraduate students that are what we call our Aggie Public Health Ambassadors that are actually circulating around on campus and now into the city itself to try to promote good health behaviors, making sure people are masked up, maintaining physical distance, good hand hygiene. So we think the combination of the health behavior change along with the epidemiologic approaches synergistically will result in a better outcome for the community. We're also focused not just on the epidemiologic measures, that is the caseload, mortality, and hospitalizations, but also looking at health behavior change in general. So we're doing some survey work to see if we've been able to move the needle on how people are behaving, their attitudes towards the pandemic and safety precautions. And now we're also moving into the sphere of vaccination and making sure that we have high vaccine uptake when vaccine becomes more generally available.
Well, Dr. Pollack, thank you. Davis, California, passing the COVID test with flying colors.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.